Hello and welcome to our exhibition Spotlight into Light Recovery and Employment. My name is Amanda Stout, and I'm the coordinator of education engagement at the Pennacrest Museums. We're delighted to welcome you to the exhibition Spotlight into Light, which is a national art activism project that seeks to dismantle the stigma around addiction. Through portraiture and storytelling, the Into Light Project exhibit offers healing and hope to create meaningful dialogue about substance use disorder. The museums use exhibition spotlight programs to illuminate deeper themes of the exhibit and build further connections to our campus and community. Whether you've witnessed addiction yourself or have been impacted by its efforts, are simply curious, today you will have the opportunity to meet researchers, academics, and staff from the University of Iowa, along who are shaping the conversation and impact around addiction and recovery. If you haven't had the opportunity yet, we highly welcome you to visit the Old Capitol Museum to see the incredible portraits that serve as inspiration and deep reflection of substance use and the people impacted by it. The exhibit and exhibition program we are presenting to you today has been made possible through all of the hard work of our staff from the Pennacrest Museum and its partners. We especially extend our gratitude to the Office of the Provost, who makes museums work and exhibits possible. I would also like to invite you to our next exhibition spotlight, Transforming Grief, on Friday, October 10th from 12 to 1 p.m. as well, in another webinar format. To start, I want to introduce you a little bit more to Into Light for those who maybe are less familiar. Into Light, Drug Addiction, Real People, Real Stories is currently in the Hanson Humanities Gallery, which is on our ground floor of the Old Capitol Museum, and it will be an exhibit until December 19th. So you have a lot of time to come view that exhibit. We're open Wednesday through Saturday, 10 a.m. to 5 p.m. The Into Light Project, a national nonprofit, creates public exhibitions and original portraits and individual stories of people who have died from the disease of drug addiction in locations all around the country. Their mission is to change the conversation about drug addiction through the power of original art and story. Into Light recognizes the powerful influence of museums and galleries to host thought-provoking conversation through art. The project selects one public academic museum or gallery in each state based on their ability to engage the community by building meaningful educational programming around the exhibit that addresses issues about the disease of addiction. The Old Capitol Museum has been chosen as the exhibit site in Iowa in 2025, and we are so happy the reach this exhibit has found all across campus and the community. These are some of the photos of the exhibit into our gallery. The exhibit features original graphite portraits of individuals who have succumbed to drug addiction or poisoning or related causes, accompanied by professionally written stories about their lives. At the end of the exhibition, the family of the deceased relatives receives the original portrait and professionally framed of all those who are lost. This week, we are discussing the topic of recovery and employment. In this conversation, we'll explore the conversations and connections between recovery, work, and community support in the face of addiction. We are featuring three members on our panel today. We have Dr. Diane Rollman, who's the Associate Dean in Public Health. She's a professor in the Department of Occupational and Environmental Health as well, and she holds the endowed chair in Rural Health and Safety. She directs the Healthier Workforce Center of the Midwest, as well as the Agricultural Safety and Health Training Program. Her research focuses on the health effects of occupational environmental exposures with emphasis on the increased workplace risks faced by younger employees. Diane, you can say hi if you'd like.
Sorry, I have to find those unmute buttons. It's nice to be here. Thank you for inviting me.
Thank you, Diane. Next, we have Ann Ashoff, who is a nurse practitioner in the University of Iowa's Addiction and Recovery Collaborative. She works with people who have difficulties with substance abuse. She is board certified as an adult geriatric and psychiatric mental health nurse practitioner, and she has been a community member of the Iowa City Coralville area for 40 years, having raised her two children here with her husband, Michael. Their son, Zachary, died of an overdose in 2016 at age 27. In her work, she focuses on non-judgmental engagement with individuals struggling with problematic substance abuse, striving to create a therapeutic relationship and providing patient-desired medication-assisted treatment. She works within the multidisciplinary team under the leadership of UIARC's director, Dr. Allison Lynch. She identifies particular interests in supporting persons with complicated and unresolved grief, as well as providing comprehensive mental health care. Anna, if you'd like to say hi, you're still muted. Oh,
Oh,
there we go.
yep, gotcha. Hi, everybody. Thank you. Thanks for having me. And Amanda, thanks for that nice introduction.
Thank you. And our last panelist is Amanda Alazer, who is a recovery coach with the University of Iowa's Addiction and Recovery Collaborative. She celebrated 5 years in recovery from heroin in 2025 and brings deep lived experience to her work supporting individuals with opioid use disorder. Amanda is especially passionate about working with pregnant women and mothers navigating substance use disorders, advocating for compassionate, trauma-informed healthcare as a life-saving intervention. Amanda, if you want to say hi,
Hello.
thank you. So I will now pass the floor to Diane.
Thank you, Amanda. So I'm going to start off the session by talking about what's work got to do with recovery. And this is work that we're doing with the Healthier Workforce Center, focused on employers and helping to support workers there. Go next slide. So I always have to start off with kind of some facts. I feel like we need to get a lay of the land to understand, what's going on. And what we're seeing is that over time, overdose deaths in general have been increasing. But if we look specifically in the workplace, we see that workplace overdose deaths are also increasing. We've had some good results in general. The last couple of years, they seem to be going down, due to public health interventions, naloxone, and also other harm reduction methods. But in general, these are really, really high numbers, and that's something that's concerning. And if we go to the next slide, we'll see that, oops, go back one. 10% of all fatalities in the workplace are a result from overdose. So when you think about some of the industries that are most dangerous, construction, transportation, 10% of those deaths are related to overdose. So this is a high number and it's pretty concerning. And if we go to the next slide, we'll see what are some of the factors that impact this overdose deaths there. And there are two things that seem to be leading this. The first one is acute injury on the job. And the second one is work-related psychosocial stress. So we know that some jobs are dangerous. You're likely to be injured in that. And if you become injured on the job, the likely outcome will be to go to see a doctor. And that doctor is most likely to provide pain medication. And so, in that situation, that could be the starting point. Another factor that we need to address is psychosocial stress or just things in the workplace that upset you. And that could be being in an unsafe environment, being in an unsupported environment. That can also lead you to feel overwhelmed and look for a way to get away from that stress when you're not working. Um, but this is compounded by things like precarious employment. If you're worried about losing your job, if your job's not safe and secure, that's a reason. That's also shows a linked with an increase. If you don't have health insurance or paid sick leave, then getting treatment may not be an option for you. Or you may not be able to take time off in order to seek treatment because if you're not working, you're not getting paid there. And we're seeing an increase in mental health condition. So there is a really strong link between work and drug use, substance use. So If we think about substance use disorder at work, in 2022, and this data is a little bit old, about 46 million Americans, 18 or older, experienced a substance use disorder. And most of them are working. 65% of them are in the workplace. So if we look at any workplace we're at, we have people who are using substances there. And the issue we have, though, is you go and talk to an employer and you ask, is this something you're concerned about in your workplace? They're going to say, no, no, nothing's going on here. We don't have that problem. But if you talk to the workers, what we see is that they actually know it's going on. So there's a disconnect. Kind of the employers don't want to see or hear anything. They don't realize that it exists, and people are reluctant to speak up because of the stigma associated with the response they're going to see. So why should we focus on the workplace? Work does a lot of good things for us. It provides us with a lot of resources. We get a salary, it pays us. That allows us to live and buy food and support a family. Many of us get paid time off in our workplace, which allows us time to recover and heal and get refreshed. We also get our health and retirement benefits from the workplace, which are things that we need in order to have a meaningful life there. Work is also good because it's often linked with our identity. It gives us a sense of purpose. When you meet someone, often the first thing you think about is, hey, my name's Diane. Oh, where do you work? What do you do? And so it gives me something to say. Um, I think, Amanda, we lost the PowerPoint. If you want to click back on the tab there. Um, but the other thing about work is there's some negative things there too. It can be a very stressful work environment, and we can also, you know, get injured on the job. And so we want to make sure that our workplace is safe and healthy there. And we may work in an environment where there are substance presence. If you think of people working in the restaurant or hospitality industry, or even in healthcare, they may have access to some of these drugs that may put them at risk. And then I mentioned stigma already, and that's a huge barrier there. People are reluctant to talk about it. That's what's exciting about this program is it makes it real. It makes us recognize that people are individuals and they're just like you and I. And we can talk about this because that's how we're going to get people to seek treatment and how we're going to support them in their recovery efforts. And so we'll go to the next slide, please. So when we think about what do you need to be successful in recovery, and this image shows all of the things that an individual needs to have a successful recovery there. They need a place to live, they need transportation, their health needs to be good, maybe they need childcare, all of these factors. But when you look at all of these factors, the other place you see these, and they're all linked to the workplace. So we want to make sure that, the workplace provides many of these things and therefore makes it a great place to think about how do we support people in recovery. Next slide. The other thing is substance use can impact the bottom line at work. You may see turnover, people may leave, they're going to have a cost to the employer if they have to rehire and retrain people or work at a shortage. If we go to the next slide, we may see that absenteeism is also a factor there. People don't show up to work. They may not feel well, and that they're not going to come to work, so you're going to be working at a shortage. If we go to the next slide, we also see health insurance benefits, and that's also going to impact productivity. Go to the next and go to the next. There are also things outside of work that are impacted there. And these things will impact an employee's, coming to work and being productive at work. If you don't have housing, if you're food insecure, if you lose your transportation, it makes it really hard to get to work. And so the more we can support people, the better off we are. And, if this is something you're an employer, you're interested in, the National Safety Council has come up with what they call a substance use employer calculator. So you put in your organization, your type of industry, and you can calculate what is it costing you as a industry working here in Iowa. I'll go to next slide. So this is a busy slide, but one of the things that people don't realize is that having someone in your workplace who's in recovery will actually save you money when you think about time off and medical costs there. And if you just look at the general workforce and you look at the number of days on average they take off for missed days of work, it's 10 and a half days a year. And if you look at somebody with substance use disorder, alcohol use disorder, or pain medication disorder, not surprisingly, they take more days off from work there. But somebody in recovery actually takes fewer days off than the general workforce. And we see that pattern where somebody in recovery is taking the same or less than time being hospitalized and other medical expenses I'm not showing, and also reporting whether or not they're experiencing serious psychological distress. So there is a benefit if you hire somebody who is in recovery. We'll go to the next slide. So, why would an employer create a recovery-friendly workplace? And a recovery-friendly workplace starts off by creating a safe and healthy workplace. So, we don't want a place where people are going to get injured. We don't want a workplace where they're in distress, a toxic work environment. You have to get rid of those hazards in the workplace. You also need to create an environment that supports people who are in recovery, whether that's helping them get to treatment or reducing stigma so that it can openly talked with and addressed. You want to provide that support. And then finally, you want to get people back into the workplace or get them into the workplace if they haven't been there for a while. So that's what a recovery friendly workplace is. And employers that have decided to focus on this initiative do it for a variety of reasons. One of them is it may be they had an employee that was a really valuable part of the team and they don't want to lose them. And the case in the yellow box talks about that. Another situation is maybe somebody in the workplace, a manager, the owner has knows somebody who has struggled with addiction or even overdose, and it may be themselves. And so they know what it takes and they know how to provide support to help people on their recovery journey. You know, and it's the right thing to do. We know that if we can create an environment that supports people, they're going to have a much successful process. If we go to the next slide. And I'm not going to talk in great detail about this, but this is just one example. It's from the International Union of Elevator Constructors. And what they did is they put into place programs that help to support people who are in recovery. They call it aftercare programs. And providing supportive services around housing, around accommodations in the workplace, and other factors. And before they put those into place, they found out only 10% of their members who went into treatment actually maintained their recovery. Once they put these supports in after they returned, they went up to 78% maintaining their recovery. So there's real good evidence here. And if we go to the next slide, I can talk a lot more about it. And as our center, we have a lot of resources here. These are available and free, and I know Amanda will send it out. So I thank you for giving me a few minutes to talk about recovery-friendly workplaces, and I'll go ahead and turn it over to Anne.
Okay, thank you, Diane, for sharing about the recovery work and all of the important research you've been doing. Next up, we are going to have Anne speak.
Thank you. Thanks, everybody. I tend to speak quietly, so somebody send me a message if I'm too quiet. Um, so I forgot that I gave Amanda such a big introduction. So some of it is I'm going to just kind of clarify, but I very much appreciate the opportunity to participate in this webinar. So thank you. Um, but as Amanda said in her introduction, Ann Ashoff, I'm a psychiatric mental health nurse practitioner, and I work with folks who struggle with substance use, problematic substance use. Some don't maybe meet criteria for disorder, but uh, anybody who wants to talk about substance use is welcome in our clinic. I work in an outpatient clinic at the university under the Department of Psychiatry, and our group is called the University of Iowa Addiction and Recovery Collaborative, UIARC. We have a beautiful website, thanks to my coworkers, and I can put that in the chat later on. But our mission statement, I think, says so much. It's to foster a collaborative and inclusive environment that empowers individuals to think creatively, act with courage, and innovate in ways that drive meaningful change for the betterment of people with substance use disorder. So in the Into Light project, I just feel so fortunate to have been able to be involved with that project. It's been such a meaningful experience for me over the years. I've done a fair amount of presenting on issues surrounding substance use and addiction and the overdose epidemic. All of it has been very valuable for me, but this exhibit brings something more into my life. And I think because what it stands for is somehow larger than anything else that I've participated in. And I think it's because it portrays all the great love that people have for their family members and compassion and pain. It's all of it, but also hope. And I think the hope part of it is what lifts me up. Um, because the more we open up conversations about addiction, the more hope we can all have as a community for better health. So the families that presented their loved ones alongside of my sons in this exhibition just feel like now they are my community. They are just another great addition to my community. And I find that the larger my community of compassionate and understanding people is, the healthier I can be. So the clinic that I work in is, as Amanda mentioned, led by Dr. Allison Lynch. She's our director, and under her leadership, we have this amazing team of people. And the one thing that is solid throughout the team is our purpose for providing care that is non-stigmatizing, zero stigma, not just stigma reducing. It's also low barrier, which means that we try to provide as prompt access to care when a person is ready to seek care. You don't want them to have to wait long periods of time to get in to see somebody. So low barrier and zero stigma. And it's been very meaningful. When I think about the many reasons that we as a society have so much trouble approaching treatment for addiction, there is one clear word that stands out very loudly, and that is stigma. And Amanda, do you want to let me run my slides through this part? Can you?
Yes, you have access. You should have
Okay, let me
access.
see where that is. That's a little, it was down on the bottom, but I'll just see if I can make it happen. Nope. Okay, so I don't see that option. Do you want to double check it? And if not, I'll
Yeah,
just.
it says you have control, but if you can't figure that out, I can just do it if that's easier.
Oh, I just found it.
Okay.
It's pop up. It just has to pop up. Oh, yes, it's elusive. Just a second. I'll get the hang of it. Um, I'm sorry. It kind of floats and then it goes away. So if you want to go to the next slide, we'll just do it that way. Stigma. This is a quote by Jerome Adams, who was the 20th US Surgeon General, and I think it says a lot. The biggest killer out there is stigma. Stigma keeps people in the shadows. Stigma keeps people from coming forward and asking for help. Stigma keeps families from admitting that there is a problem. Now, for a minute, I just want you to just stop for a second and pause and think about what kind of image comes up in your mind when you think about somebody who is in the depths of addiction. And you can go to the next slide, Amanda. And the next. So, okay, and then let's hold there for a second. So these images in my mind, depict people in very, very painful life circumstances. And that is, I will say that is what I thought about addiction. That is what I thought people looked like when they were in the depths of addiction. Next slide. Sometimes we think about celebrities because we hear so much about them. This is Prince. He died in 2016 of a fentanyl overdose. And the next slide. This is Amy Winehouse, who died in 2011, and she was 27 years old, and she died of alcohol poisoning. And the next slide. Okay, and so this is Prince at age 11. And this is what I challenge everyone to think about is that, this we don't let ourselves think about these people as children often. And the next one is Amy Winehouse when she was a toddler. Okay, and then the next one, this is my son, Zach. Zach was 27 when he passed in 2016 of a heroin overdose. And then the next slide is this is Zach when he was 6, just summer bliss. So I just feel like it's important. My point being, everyone who's struggling with addiction is somebody's baby. It's somebody's brother, somebody's sister, somebody's cousin, um, somebody's grandchild, and somebody's mother or father. We always need to keep in mind that there are many, many children who have lost their parents to addiction. And not to forget, we have children's grief to keep in mind. Okay, and then the next slide. So I want to spend a little time just talking about bias because these are powerful, there are powerful emotions that are centered around our perception of people. And implicit bias is very real. We all have it. There are attitudes and beliefs about race, ethnicity, age, abilities, gender, or many other characteristics that operate outside of our conscious awareness, but they impact our judgment unintentionally in how we treat and perceive others and how we behave towards them. So these biases are often learned in our childhood through cultural exposure, and then they're internalized over time. Automatic thinking is not without value. It can be an essential tool in many life situations, and particularly in healthcare and other emergency situations. So we all have biases, and we are most likely to default to damaging biases and damaging stereotypes when we are stressed out. So we're busy, we're distracted, we're tired, we're anxious. Okay, next slide. So there are some ways to mitigate bias, and I won't say that it's easy because it's hard to access unconscious feelings, but we just, I think, need to begin with awareness and recognize that we all have biases and develop an ability to like shine the flashlight on yourself or look in the mirror, what is it? Ask yourself, what is it? Why am I feeling this way about this person? What is actually happening beneath my judgment and assessment and expectations of their behavior? So acknowledge your own reactions, acknowledge interpretations and judgments that are below the surface, and explore awkwardness and discomfort. It's okay to stumble with words and conversation and say, let me back up. I can do that better. Engage with people that you consider different than your community. So consider them others, listen and learn from them. There's much to be learned. Explore stories, film, and literature where different voices are at the center of the narrative. And focus on the shared humanity and the commonalities between people without ignoring the differences. Okay, next slide. And I just want to give a little attention to words matter in addiction treatment. And this is hard, and I have to practice. I'm not going to lie about that. The language that we've used for so long surrounding people with substance use disorders was not substance use disorder. It was addiction. It was an addiction by itself is not a no-no word. but addict. So these are labeling words, and if you look at this website, there's other good ones as well. This is from NIDA. Um, I can I can also put another reference in the chart in the chat later, but it does help you focus on patient-centered language. So instead of saying a person is, for instance, an alcoholic, rather say it's a person with substance use disorder. Or if a person is rather than saying an addict, it's a person with substance use disorder. So it's if you put the person in there right away, it becomes easier. And then there are a lot of other, this website is really good for other terms in addiction practice to avoid. I'll let you explore that if you're inclined. Next slide. Okay, and then I want to finish with just a couple of beautiful quotes. Krista Tippett on Being is one of my favorite podcasts to listen to. And one of the things I heard her say once and put it in my heart was this: one way I've come to think about questions, the power of questions, is that questions elicit answers in their likeness. You call forth something beautiful by asking a beautiful question. So, in other words, when you're asking people about their lives, if you ask them questions like, are you married? Are you, these are like social, this is chit chat, social chit chat. Are you married? Do you have children? That's a big one for me. Like, I don't know how to answer that. Yes. Which version do I want to give you? These are touching. I mean, it gives you some insight into the fact that not everybody's living the same life that you are. And so those kind of conversations should be approached gently and carefully. And the next one is another beautiful, one of my favorite poems is by Emily Dickinson. And this is something I read often. Hope. Hope is the thing with feathers that perches in the soul and sings the tune without words and never stops at all. And the message that I take to work with me every day is that it doesn't matter how many times somebody's been through treatment. This next one, there's no reason to think that this next time won't be the successful move for them. I think that'll do it. Thank you.
Thank you so much for sharing, Anne. It's really great to hear about your personal experience as well as your work experiences in this work. And I think we all like to learn about how we can help with our own bias and stigmas and how we can talk professionally and appropriately in this. We will pass the floor to Amanda now.
Hello, everyone. My name is Amanda, and I work with Anne, Dr. Lynch, and our team at the Addiction Recovery Collaborative. Every time I tell my story, and they ask me, whoever it's for, asks me, well, do you have a PowerPoint? And it's so hard to put my presentation into a PowerPoint. So I have started just kind of placing my personal journey map as my slide in my presentation. So I'm part of the Empower Project, which is a collaborative for moms in recovery to be a part of research. So I did this journey map last year, and at first it feels a little overwhelming, but it was actually the most healing process. Like, even I always tell people, even if you don't are not a person in recovery, like, I suggest trying to find someone who can do this personal journey map for you, because it was wonderful, and I actually still use this to this very day. But nevertheless, my name is Amanda, like I said, and I celebrated 5 years in recovery in May. I struggled with a heroin addiction for almost 6 years. And through those years, I lost my brother, and then I lost a child to SIDS. I lost custody of my other children, and then I lost my husband to overdose. And honestly, by the time my husband had passed away, I had just completely given up and had decided I didn't even want to be sober. I'm like, there's no point. And so I guess I that changed all whenever I found out I was pregnant at the end of 2019. And I, was living on the streets. I didn't have anywhere to go. Wasn't sure what I was going to do. And so I did what I did best back then, which was kind of ignore the problem. But obviously, you can only ignore that for so long. And towards the beginning of my third trimester, I went to the hospital and got connected to an outpatient clinic in Burlington where I went one time and the nurse, the doctor, both were not nice to me at all. I'll never forget the first thing she said to me, the physician that walked in, that I didn't know her, she did not know me, was, well, you have so-and-so in your system. Like, so are there more drugs you need to tell me about? Like, was it hello? Was it, that was it. And one thing I can guarantee you is as someone who has used drugs during pregnancy, um, we hate ourselves more than probably anyone else can, and there's a lot of guilt and shame. And so, of course, after that appointment, I was like, I'm never going back there again. And I had just planned, okay, I'm going to wait till I go into labor. I'll go to the hospital. I'll have this baby. He'll have a better family. He or she will have a better family. And that'll be it. And then maybe just a week or two later, I got connected. A friend of mine connected me to this midwife named Megan. She's at the university, and she texted me and she said, I've heard your story and I really want to help you and I want to keep you and your baby together. And I was like, that's weird. I don't even know this lady, but I took my chances and I came up to the university and I got up on the labor and delivery floor and I talked to the social worker. And what she said to me was, when I asked her, do you think there's actually a chance, like I could keep my child? And then she said, oh no, you should have asked for help like several months or weeks ago. Like it's too late now. And so I immediately was like, okay, I'm leaving then. And I was upset and I thought, gosh, I just came up here for no reason. And at the time, again, I didn't have anywhere that I was living. I didn't have any place to live, transportation. So it was a miracle that I even got up here to Iowa City. And then I left, and that midwife would text me just like once a day, maybe once every other day, and say, like, I hope you're doing well. I still want to support you. I hope you can make it to the university to deliver. And 2 weeks later, I went into labor and was able to come up to the university. Again, I came to the university with thoughts that I would leave as soon as the baby was born, that the baby would have a better life without me. And all of that changed the second that my son was born. He changed my entire life, the way I look at things, and it was in an instant. And I wholeheartedly 100% believe a big push in that was I had these people who I didn't know and they didn't know me, but they were, cheering me on, and they're like, we want to help you. We can help you. You can do this. And I think that's what I needed in my life, was somebody to say, you can do this. Even if it was a healthcare worker that I had never met before a day in my life. But I was able to stay with my son while he was in the NICU. And then we went to Heart of Iowa, which is a treatment facility in Cedar Rapids for pregnant and parenting mothers. And you're able to keep your child with you. So he was able to come with me. So I'm happy to say that now he is in kindergarten. We have never spent any time alone, or any time apart, I mean. He is a smart, healthy, fun child who I am so blessed to have. But I tell my story because I know that if I hadn't have got this just random connection to the university, if I would have been in the smaller town, I know for sure my life wouldn't look like it does now. And I also know that my son's name wouldn't be Luca, right? And then I started working at the university a little over 2 years ago now as a recovery coach. And the best part about my job is that I get to work with women who are at Heart of Iowa. We have a mobile clinic that goes there every other week. So the majority of the patients that I work with are people there, and then also meet people through our inpatient consult service. But as a recovery coach, it's kind of a whole presentation in itself. So I'll just kind of give you an overview. I think my other peers would be mad at what I'm about to say, but it is very similar to like a sponsor. It's not the same. We do have training and obviously we're paid, and we also have, most of the 12-step programs where their sponsors are people who are abstinence based, whereas we have the mindset of you're in recovery if you say you're in recovery. I've come to learn that recovery looks different for everyone. Total abstinence is how it works for some people medication. But my role in that space is to advocate for the patients, right? To make sure they are getting the health care they deserve. But then I also work with their DHS caseworkers to try to get them reunited with their children or try to keep their children with them. So I get to kind of do a lot of different things, but I'm very grateful for it. Honestly, helping women it helps my sobriety too. And then my 10-year goal, which I think we're about down to 8 years now, is to open a recovery home here in Iowa City for women. So hopefully in about 8 years or less, you guys will see a recovery home opening for women sometime around here. But I believe Amanda will have all our information. So if anybody has any questions about recovery coaching or how somebody can be referred to me, I think Amanda can send that information out. But anyways, I just want to say thank you all for being here. Thank you for listening. I enjoy telling my story, but I always tell everybody the most important people are the audience, right? Because I could tell my story till I'm blue in the face, but it's the people listening. That's the whole point. So again, thank you all for listening and being here.
Thank you so much, Amanda, for sharing. It's really brave of you to share such personal details about your life, and it's really great that you're using your history to change other people's lives too. We are going to move on to the Q&A session of our webinar. So feel free to drop any questions in our Q&A, and we will start asking our panelists some of the ones that are already here. I have one specifically for you, Amanda. It says, congratulations on your progression. You are working in the field now with some of the same folks who served you when you were in need. That's just incredible. Could you speak to what it's like to be on the other side at the same place now helping others?
So even so, over 2 years later, there are still times that it's like surreal. It's amazing, and I think another aspect that I love is the physicians that I work with. They are openly, like they want to hear what we have to say, and so um, that down the line helps the patients receive better health care. But I just, I wish I had some like extravagant way to explain it, but it's amazing. Like I absolutely love it. I never thought I would be in this space. And again, 6 years ago, you could not have paid me to believe that I would have made it where I am today. No way.
Thank you. The next question I have is for Anne. This anonymous attendee says, I heard your interview with Charity Neb a few months back. I thought it was so brave of you to share. How heavily does your personal experience play out in your day-to-day work?
That's a good question. Hang on, my video going. Yeah, every day. I'm not gonna lie. I go to work every day with my son right on my shoulder. I mean, he is right next to me with that, like that picture with his arm around me. And I think the biggest challenge for me was when I first started doing this work is whether I would be too fragile emotionally to be objective with my patients. And I don't know how or why it hasn't seemed to be the case. Um it's been nice, and uh there's just so much I would not have known had Zach, not had these experiences. And I would trade it all for him to be alive and healthy. But it just gives me so much, oh, I don't know what the right word is for risk of overusing, but just passion for the work. I know that that person sitting in front of me is somebody's son, you know, and I know that they have every chance and every opportunity should have every opportunity to get to a healthier place in their life. And yeah, that's that's how it is.
While you're on, Anne, would you mind sharing a little bit about what it's been like having your son in the exhibit as well?
Sure. Yeah, it was hard to at first when the I think Dr. Lynch brought it up to me, and I said, "Oh no," because my feeling was that I've told I did so many presentations early after when I was really just struggling so much with my own, what am I going to do about this, kind of emotions. How can I make something better out of this? And so when, oops, I lost my train of thought. Okay, so when this offer came, I thought, I don't know, it's so much you have to dig through all the notes and all the pictures, and it's like it's so difficult and time consuming, and you just don't know what if your day is just going to completely unravel, and you have to just go to bed, or if you can, go through those pictures and find something to smile about. And it's both. It's both for sure. But so the process of putting the story together, which the artists and the writers were just so amazing, and then picking the picture that I thought was most representative was very difficult. But once it was up, and the first time I looked at it in the room, was pretty emotional. But then when I started looking around at all these other people and these other faces and these other families, and it just became a very warm feeling. I like to talk about him. I think the worst thing for losing a kid is that the concern that he'll be forgotten, and that would be the worst thing for sure. So lift up their voices. They were loved.
Thank you for those powerful words about that. Um, our next question, I think Amanda Laser touched on this with her experience in a rural healthcare facility, but they ask if Diane could speak to the unique challenges rural communities face in addressing addiction and recovery, and how can employment initiatives help bridge those gaps?
Thank you. That's a great question. I'm so honored to be part of this panel just because I'm hearing about these experiences. And, I think when I think about rural areas in particular and those communities is they don't have the same resources. They don't have a University of Iowa hospital clinics here. They don't have treatment centers, but they do have maybe more connectedness. And that's why, focusing on employers who are often the lifeblood of a community, whether it's a school or the hospital, and having them take the lead on recognizing that these individuals are people, and the more you support them, the more that's better for your community. So healthcare systems, I think, always need to evolve, and always there will be improvements there. But we're overlooking, in my mind, those employers. And I think they have two roles. One is that prevention is, having a workplace where somebody can make a living and support a family off of, but also enjoys going to and isn't afraid or worried about getting injured. So that safe and healthy workplace is really good. And as I mentioned, that's where we get our health insurance from. Most of us get our insurance from our employer, and there are treatment options that are available through that. So they can advocate for those and make sure that those options are reasonable and will support their workers who may need to travel or have accommodations. The other thing employers can do is that recovery piece is bringing people back to work or getting them into work. Work gives us structure. I mentioned the salaries, I mentioned the benefits, but it's that sense of purpose and a reason where you have to get up in the morning. Recovery isn't a one and done. It's a journey. So it has to be a workplace that's going to allow accommodations. Maybe you need to go to a meeting. Maybe you need to have an appointment. Maybe you need to work part-time as you are dealing with many things. But these things I think pay off in the end. And that's why I spend a lot of time trying to educate employers about this, trying to reduce stigma and to get the business case to because employers need to keep their lights on too. So I think I answered that.
Yes, I think you did. While you're still on, though, could you answer one more question, specifically for you? Are there protective worker laws to keep folks from being fired for substance abuse disorders?
So that is a great question. I don't know that I have the answer, but I will sure be looking that up. So feel free to email me and or email Amanda Stout, and I'll get that answer. Um, it could depend on the workplace policies. People are afraid to talk to their employers about stigma, or because of the stigma around it, or because of repercussions. A lot of employers, if you notify them, say if they say there's a scheduled drug test and you go to them and say, I don't want to take the drug test, and then you say, I want to talk about treatment options, they will support you in that. So it may vary a lot on workplaces. There are also workplaces because of safety issues, they have to do the drug testing and you know, um, you can't be using. So it can vary. It also could be a positive drug test could trigger a response from an employer. I just want to clarify, a recovery-friendly workplace doesn't mean drugs can be used there. It can still be a drug-free workplace, but it's supporting people to maintain that and to giving them, a chances to maintain that. So I'm going to look that up though. So follow up.
Okay, thank you. Um, I have a question that any of you can feel free to jump in on. What role does employment play in sustaining long-term recovery, and what barriers do people in recovery often face when seeking work?
Oh, can I answer this?
Absolutely.
I wanted to start with the barriers because this is something that comes up a lot and that I'm actually in my personal life advocating for change. But it, especially in the workplace, is really hard. I don't think that I would have never been able to work at the university had it not been for Dr. Lynch, who knew me personally and was able to vouch for me. I had to go through a month of explaining. I had to go through every charge I've ever had and explain why, like what the situation was, what happened. But then I was able to also write an essay about, things that I've done to rebuild my life and why I'm quote unquote safe to work in healthcare. And I did that. And I will tell you that process was really humbling and it took a long time. And then I was approved through DHS pretty quickly, but then I had to meet with the vice president of HR and the legal team. I mean, it was a whole process that I don't know that just like an average person would go through. I would not have honestly. And before this, any job that I've had and I'm not even a felon, right? I have a lot of like petty stuff on my record, but I'm not even a felon. But as soon as you click yes on that bar, it is immediate. No, like no more. Can't go any further. So it's really hard, and it really makes you feel like, when are you going to be done paying for your wrongs in society? And I've come to learn that I I just don't know that I ever will. It's a constant issue. It's not just in workplaces. It's housing. Um, so many different things. It's really hard to rebuild your life after addiction. You have to have the right people. I talked to Dr. Lynch about this yesterday. I wish there were more people that had their Dr. Lynch, or had their, Megan, or whoever. Um, and then, as far as, what was the first part of that question? I feel like it.
What role does employment play in sustaining long-term recovery?
Okay. And I just real quick, I wanted to say, so the first 2 years of my recovery, I worked at a factory. The first year I worked in the factory, and then I was able to move to the office. And I worked so much overtime during that I used to have to get permission from the plant manager, but I was so terrified to be not having anything to do. Like, I was terrified to not be busy, even if I wasn't at work, as I was at a meeting or I was at church. I was scared to really be alone with myself. And so I work. And then even when I got to my office position, I was like taking everybody, you're supposed to work one Saturday a month, and I would take everybody's Saturdays for them, which they loved. But it's probably about year 3 that I kind of eased up on that. But for me personally, work has been huge. It's nice to feel like you have a purpose, and then have a routine. I'm somebody who loves routine, structure, and that's the workplace has always been able to provide me with that.
Thank you so much for sharing, Amanda. I have one last comment from our attendees that I want to share. This is from Lori Sandblom. She says, "My son Matt is also in the Into Light exhibit, and I want to thank those involved in the display and thank the panel for sharing." So thank you all so much for being here today, both our panelists and our attendees. We feel very special to have this exhibit up right now, and we are really happy that our panelists were able to help tell this story as well. I appreciate all of our attendees' time today. The presentation has been recorded and we will upload it to our website soon. So feel free to pass it along to anyone else you think might be interested in learning more. Um, Make sure to check out our next exhibition spotlight on October 10th if you want to learn more from a different panel. And please come check out the exhibit in the Old Capitol Museum. I hope everybody has a wonderful day.
Thank you.